What brings you to see me?
I had this thing on my back. It started out like real small, and then I itched it one time and halfway came off, so I just ripped it off. Okay, you know, I was stupid. But yeah, blood and blood and blood, but it just got bigger and bigger and bigger.
This
is like over 2 years.
Oh yeah, that needs to go. You got a basal cell skin cancer on your back. Basal cell's the least aggressive. It's not going to kill you, but it's going to grow and persist slowly. We'll get it off there today and see what the depth is. Depth is what determines what more or less needs to be done about it.
Okay.
But you know, that's what it appears to be. I'll get it sent to the pathologist to get the final word. The rest of it. Anybody in your family, mom, dad, brothers, sisters, have any problems with skin cancer as far as you're aware?
No. Not that I'm aware of.
The rest of the back looks fine. Pretty young to have basal cell, but it happens. Usually in younger folks, it happens in an area or somewhere along the line you may have got a good sunburn, and it doesn't have to be recent. So high back, high shoulders, upper chest, face, that sort of thing. So we'll get it off there. What I do today is I just get some local anesthetic in there, and I take that away and send the specimen to the pathologist and see what the level of involvement is or isn't. Check the upper chest. This is an area too in women that you need to watch. Okay.
We were speaking with someone who has skin cancer, and they requested that she get an excision. Do you do an excision?
Yeah, I mean, you don't do an excision today. You make sure
Okay.
that it's cancer before you cut a hole in someone's back.
Okay.
But then, if there is, number one, if it is basal cell.
Sorry. You're a little bit dirtier.
If it is basal cell and it's nodular and involving the dermis, yeah, it's excised around with standard 3 to 4 millimeter margins and closed, and then a secondary specimen sent to make sure that everything's clear, both wide and deep. I mean, it's standard of care.
Okay.
If you have a superficial BCC, treatment algorithm includes ED&C or actually even some FDA-approved topical creams, but for a dermally invasive basal cell, I mean, an excision is what would be done. Hopefully by anybody that had any idea what they were doing.
Okay.
Okay, here's the deal. Use your sunscreen. Okay?
Yeah, I always do. Ask him. I'm
Yeah.
like, so...
Because you're young, you know what I mean? Most of my basal cell patients are 30 years your senior, but I see folks in their late 20s and 30s that make this, and so you just want to be careful moving forward. It doesn't look like you beat yourself up now. I would assume that there may be a little bit of a genetic predisposition, and it may be the area that you had a sunburn when you were 17 years old. You know what I mean? Hang tight. I'll have one of the nurses come and get you, and we'll get this area anesthetized. I'll get it off there. We'll send it off to the lab. What the lab will tell me, one, is it's basal cell, and two, they'll confirm the depth or lack thereof. Depending on the depth that is read by the pathologist, that will tell us what we need to do as far as treatment. If it involves the dermis, it'll be excised with some margins in normal skin, and then closed up with sutures, and it'll be gone. We'll take care of it as the pathology through access to.
Okay.
All right? Give me a minute. I'll see you in just a moment. All right?
All right. Thank you. Let me see how dirty your feet are. Yeah.
Okay.
Hello.
Hello. Got spots on your back?
Yeah, it's like right here.
Okay. Let me get...
So itchy, too.
I'll have you stand up and we'll close you up in the back because we have to go to another room. Okay. And then if you want to gather all your stuff, your clothes and your purse and all your items, and we'll go to another room, and then when you're done with that room, you're done. Because we're not going to come back here.
I'll just go on to everything.
Alright, we are headed straight home. And before you do anything else, your date of birth, ma'am, is what?
9874.
And you are allergic to no allergies that you know of?
No.
No pacemaker, nothing like that in your heart. I do need you to sign a consent form. lunchtime, I'll get the date. And if you could print and sign, that'd be great. And then give me 1 second and I'll lower the head of that so you can lay on your belly. So if you want to lay like this. And you're going to want to turn your head the other way.
Okay.
That way you don't even have to look.
Will the doc be okay if I record this?
You can ask.
Okay. All right.
He has ADHD, so he forgets everything he wants to.
Yeah, I want to remember everything the doctor says, so.
Sure, you'll say okay, but can honestly say I've never had anybody ask me.
That's only you.
Yeah, only me.
I don't want to see it.
Yeah, you only want to go through it once, right?
Yeah, what's gonna exactly happen?
He's just gonna numb it, and we're just gonna take it right off.
So it's gonna be like then just straight.
Is it gonna get stitched?
No,
No, not. That's only if they go deeper.
that's only if we have to go deeper. You don't want to go deep until, you know what I mean, unless you know that there's a problem. Otherwise, we just left this big scar on your back for what?
Right.
It was
Okay.
fine, you know what I mean?
Okay.
So, right now, it's just taking it off so that we can find out
And then
what it
just
is.
scab or what?
No scab. I'll go over all the healing or how to take care of it when he's done. But we like polysporin ointment here. Have you ever heard of that?
No.
Have you heard of Neosporin?
Yeah.
Everybody likes Neosporin. Well, do you have Neosporin at home?
You know what, I think we just ran out of it, but
Yeah. Yeah, I don't think we
I
have
could get
any.
some.
Okay.
We have a 6 and a 10-year-old, so we always
Oh,
have
then
we
yeah,
always have
okay.
Neosporin on hand.
Yeah, I have that spray stuff, I know. The spray
Okay.
one.
Well, I like I said, we like polysporin here. So if you have to buy it, we'd rather you bought polysporin than Neosporin.
Always. Hey Doc, do you mind if I record this? Okay. I just want to remember everything that's said.
We're going to feel just a little bit of cold, wet soap, and that's just to cleanse the area, okay? And then you'll feel a couple little pinches, and that's the numbing agent. And we'll get the area numb, and then we'll get this off there and stop any minimal. You may just want to give me a 3 cc, Laura.
Alright.
Any minimal bleeding will get stopped, and we'll get a patch on there. We'll send the specimen off to the pathologist, and when we get the result back, we'll give you a buzz, okay? On 3, you're going to feel your first little pinch, okay? 1, 2, and 3. And that should let up here shortly. And usually about a week, we'll give you a call. There may be a little bit of delay with the holiday kind of being in between, but our turnaround generally is pretty quick, so we'll let you know what's going on and what else we need to do, if anything. Okay, good.
Hurt, huh, babe?
Just left upper back. Fine.
Okay.
All right.
It's gone.
Gone. and we'll see
Oh,
what...
you already did?
Yeah.
Yep.
We'll see what depth is or isn't there. And,
I don't feel anything.
yeah, that once the lidocaine gets in there, you're
It's gone.
usually in pretty good shape.
I don't even feel, like, I feel your...
Moving around.
Yeah, I
Yeah,
feel
pressure.
like a pressure, but that's
Yeah. Kind of an odd feeling, I suppose. And then Laura Marie will get this patched up, and she'll tell you how to take care of the wound, and there'll be some written instructions that go home with you to remind you. And as soon as I have information back from the pathologist, we will give you a call and let you know what's going on.
Okay.
All right?
Okay.
Thank you.
Oh yeah, no problem.
Is it covered, or?
No, she'll cover it.
I don't know what's happening here. Chuck, you're so weird. Push the finger. Stupid.
All right. You guys take care. Have a good holiday weekend.
You too.
Or
Thank you.
midweek,
You too.
or whatever your course is. As soon as I get some info back, we'll call. Okay?
All right. Thank you.
Yep.
Alright, I'm gonna put a dressing on there that I want you to keep on for 24 hours.
Okay.
Tomorrow you can take my dressing off, shower, bath, whatever you do is wonderful. And like I said, if you decide to, instead of buying Neosporin, to buy Polysporin, that's fine. That's what I'm putting on your back now.
Okay.
It's like Neosporin, it just doesn't have neomycin in it, which after continuous use we find people start calling and complaining about the area being irritated or itchy or burning.
Oh my God, mine is always itchy.
It's always, that could have been just because
Yeah,
it needed
because
to
of the
come,
thing.
right? But your wound should not feel like that while you're healing it up. And if it does, then wash off your Neosporin if that's what you put on, and use Polysporin or even plain Vaseline. The idea is we do not want it to let the air hit it. You don't want it to scab up. Scabs slow down the healing process. They leave an ugly scar. If you do it our way, you won't even know we were here.
Okay, that's good.
So basically, clean it, put ointment on it, and a Band-Aid
Okay.
for the next 7 to 10 days.
And since she can't reach it, I'll be doing that.
That'll be you, sir, yeah.
What's your job?
Absolutely.
Yep.
And a regular Band-Aid. You don't need to get
Yeah.
all fancy like that.
Okay.
Rennie, how you feeling? You okay? You're not sick to your belly or dizzy or lightheaded or...
No, I think I feel okay.
Okay, you want to sit up? And then just give yourself a second on the side of the bed. Just kind of sit with your legs on the ground. Just relax for a minute. I know you're okay, but just relax for a minute.
If it was me, I'd have fainted by now.
I
They
know,
they
he
drew
fainted
blood.
in blood.
Yeah, they drew blood from me just for a little, vial sample of blood, and I passed out. I can watch it, but I just can't
I
have
was
it done
gonna
to me.
say, now is the time to tell me after you stood there and watched it.
Yeah, I don't mind. I can watch the goriest things, but when they're done to me,
Or
forget it.
Vaseline if you have a problem.
Okay.
Okay. I'm gonna show
But
you
I should apply this all the time, right? Like for 2 weeks?
for 7 to 10 days until it's all healed with new pink skin.
Okay.
This is our handy dandy dressing room. It'll give you a place to put your top back on. Ta-da!
Okay.
Oh, okay, thank you.
You're welcome.
You want to hold this for me?
Cool.
They have this pretty cool, huh? Called dressing look. Here's the gown I was wearing.
Okay.
Here we go.
Thank you.
closed it this way.
You can, absolutely.
Great, thank you so much.
You're very welcome. You got one more pit stop when you're ready. That window straight ahead. Yep, have a good one.
You too, thank you. Hi, Don.
All right, we did a biopsy, and we'll have results in about a week to 10 days. And you're good to go.
Okay, thank you.
See ya.
Okay, see ya.
Yeah, well, I have to ask him, because you know he's hard on Friday.
Thank you.
Yeah. Well, they talked me out of it. I couldn't let you put a hole in the back since he said it wasn't melanoma.